Okay, it is 9:30, so we are going to go ahead and get started. Good morning, everyone. Hope everyone is enjoying some of the warmer weather we've had over the past couple of days. I know I am. We are here and ready to get started. We do have several pre-submitted questions, so of course we'll always start with those, and then we'll take anything in the chat box. But we're going to kick it off the way we always do, and I'm going to turn it over to Commissioner Turner to say some words. Commissioner, good morning.
Good morning, Karen. Good morning, everyone. Thanks again for joining us today. Appreciate your time, and thank you for everything that you're doing. Hopefully, we're getting on the tail end of this. We can get out and see you guys, but I know it's been a long journey, and you guys have been heavily involved in that, and I'm extremely grateful for your efforts and your partnership. I know we got a lot of good questions today. I certainly won't delay, and you don't need to hear any more from me, so I'll pivot back to Kara and let us get started with office hours. Thanks, everyone.
Okay, so let's get started on some of the pre-submitted questions. Some of them are questions that we actually got several of different variants of more or less the same question, so we know it's on people's minds. So we're happy to start to talk about this stuff. The first is so since everyone has been contracted with the MCOs prior to July 1, how do 1915C waiver and ICF providers go about doing this? Where do we get the information on who to call and how to do this? I'm going to turn this one over to Jordan Allen to get us started this morning. Good morning, Jordan.
Hey, good morning, Kara. Good morning, everybody. Yeah, so a couple of things. First and foremost, the managed care organizations have already begun the process of reaching out to agencies. Yes, it's true that every provider agency currently within the network, if you are not already contracted with the managed care organizations, you will be contracted with them previous to the implementation of alignment on 7/1. I think what makes a lot of sense, because we do appear to be getting this question each week, which certainly indicates that MCOs are contacting providers at a cadence that isn't reaching everyone already. I know that there is a pretty strict turnaround deadline for the managed care organizations to begin the initiation of contracts in order to be ready for 7/1. So I do anticipate everybody will be contacted in fairly short order, but it probably behooves us to get information directly from them in writing and then distribute that through open line, just to ensure that the people that aren't attending office hours or may miss a meeting here or there are getting the information. So we'll do that to help control some of the anxiety if you're an agency that has not yet been contacted. Thanks, Kara.
All right, next question is related to that. With the July alignment, what will be the method of providers contracting for 1915 waiver services? Will amended contracts provider agreements need to be signed with the MCOs? And will the current provider agreement with Diddb be void? So back to Jordan on this.
Yeah, the short answer to each of those is yes. So the Diddb 1915C waiver contracts, though we're aware those contracts run through 12/31 of this year, will be voided as of 6/30/21 in order for the contracts with each managed care organization to become effective on 7/1. So yes, each provider agency will need to have their own individual contract with each of the three supporting managed care organizations, and yes, your current provider agreement with the department will end on 6/30/21.
Thanks a lot, Jordan. Okay, our next question is also going to be for you. It is about the Katie Beckett program. We have had a few occasions where a family receiving Katie Beckett services would like EVC to purchase an item for them, so the provider agency to purchase an item for them, since we are set up to be paid through the waiver. Has any consideration been given to offering providers a small admin fee to provide this service? Jordan.
Yeah, thanks for the question, Jennifer, and it's a good point. While the majority of services, obviously, I feel the need to iterate, if it's a direct service like your PAs, your respite services, then the methodology of the rate in and of itself contains an administrative overlay that obviously helps offset that cost for an agency. In this case, it sounds like EVC is being asked to be essentially a pass-through for funding, and I do understand your point here. If you have the direct relationship with the family feels comfortable with you, and their intent would be, or their desire would be, for you to establish the order because you have a relationship with that vendor, then those funds in effect are just being passed through EVC, and you know, the potential that you should be compensated for that effort certainly is well heard. We have not discussed any potential stipend. Again, there may be intricacies around that, with the waiver rules certainly being firm on the fact that you can't supplement an approved waiver rate. So I think that it's a discussion that we need to have. We'll pull it out of this discussion because I think I've run up to the border of what I can provide with any degree of detail, but I do think it bears some consideration going forward. So I appreciate the question, and it's a very good point.
Thanks, Jordan. Okay, so our next question we got, which was a good question that has several questions with it, is in regarding to records retention and paper records. For the interest of clarity, we did get the question, and we think it's something that people will be interested in. For the interest of clarity, we are actually going to put this in a future open line article to help provide some clarity there. So thank you for the question, and we see it, and we are looking forward to responding in open line. The next question is in the chat box. So going there, some providers have been told that enabling technology will have its own waiver in the new unified system. Is there any information that can be shared if this is the case? How would the waiver work, and what would be included in such a waiver? Jordan.
Wow, really, really good question, Steve, and I appreciate you bringing it up. So I'll say this, that there's been consideration, as you guys know, the groups that we're meeting with, and Steve, you sit on a couple of them, we are not considering anything off limits as it applies to the single system solution that we're talking about. Again, for the broader group, I want to make very, very clear here that there's a line of differentiation between the alignment that will happen on 7/1/21 and this discussion about what a future single system environment might look like. So that the latter of those two is in very active conversation now, in formative stage, in no way is definitively determined. So as it pertains specifically to a technology-only waiver, certainly there is some consideration about that. The potential exists that we may be able to develop a waiver for people that want to utilize technology that is separate and aside from a main waiver, for instance, that focuses on displacement prevention or preventing learned dependence. All of the concepts that we've already seen become so immediately impactful for people that are already in services, but at least as importantly, have prevented people from moving into 24/7 service environments when in fact that's not what they needed at all. And so as we kind of concept what a technology waiver might look like, and that's not to insinuate that we've gotten far enough along to determine that we would develop a separate waiver, but I don't think it's a terrible idea, and it is certainly something that we're kicking around at this point. There may be some real value in that. There's some analogy between that kind of waiver and the self-determination waiver. If we can get folks that are already interested and want to move into a technology-enhanced environment right off the bat, rather than establish a dependence on staff, then we want to make sure we're there to meet those folks with that desire. And we could do that within a big waiver simply by setting services and availing services in a large waiver to those folks, or we may be able to carve those folks out, put them on a separate path in a separate waiver. Those decisions just haven't been made yet. So as it pertains to how that would work, I think a lot of that would go into the discussion around design, but the concept certainly has merit, and we look forward to continuing to consider every and available option for people, just to make sure we're giving folks what they want and establishing a level of independence for people that they're capable of right at the beginning.
Thank you very much, Jordan. Let's see what we've got. Will Med certification and the requirements for Med administration change with the 7/1 changeover? Going to turn this over to Teresa Sloan. Teresa.
Hey, Kara, the answer to that question is pretty simple. It will not change. The medication administration is statutorily given to DIDD, and we operate that program through our rules. So that is not directly connected to the waiver. So that will not change on 7/1.
Thank you very much, Teresa. Okay, next question is, will hospital attendance funding still be available after June 30th? If so, will the process remain the same? Jordan, can you take this one?
I'm sorry, Kara, can you repeat the question? It broke up right at the end.
No problem. Will hospital attendance funding still be available after June 30th? If so, will the process remain the same?
So yes, hospital attendant funding in the 1915C waiver program will continue to be available, and the funding for that, as you know, right now it's a state-funded service. The funding for that will continue to be provided in the same way it always has. So a state service plan will be generated. That service plan will go into the regional office, receive approval, and then availability of the 24/7 on-call phone in order to receive M codes if you're off hours and that kind of thing will remain in place for now, yes.
Thank you so much, Jordan. Okay, I don't see any other questions in the chat box. So I'll pause for a second, but instead of pausing, what I'll let you all know is, first of all, we do have a presentation later today for Katie Beckett families who are in Part B and utilizing the HRA account with PayFlex to help folks understand a little bit more about how to utilize that service. Also, you all are probably aware that the public comment period for the 1915C waivers is closed. So, so we are, of course, thank you all very much for your comments. We are going through those and working to answer them. We do have a question about the REM alignment. Will new training materials be available for face-to-face trainings? Teresa, would you like to take that one?
Yes, ma'am. Yes, there will be. We will be doing a train the trainer for agencies that do not have access to Relias or agencies that don't have access to computers for their staff. We just need those provider agencies to identify themselves. So there is information on the REM page telling them how to do that. But if they could just send their name and information to the REM mailbox, we will have someone reach out to you and we will do a train the trainer with one of your staff with paper materials so that you can get those trainings complete. I also want to mention, Kara, that we are having our biweekly REM WebEx this afternoon as well. So we'll be available then to answer any specific questions. If the person tries to send that email and doesn't get a response, they can bring it up during that call. Thanks.
Okay, we do have a couple more questions coming in. Someone asked me if there are special efforts to address vaccine hesitancy among DSPs. Is DIDD or someone doing that? So Dr. Davis is not with us today, but I will say that we, from the communication side, are trying to do what we can to promote the vaccine amongst DSPs. Although I will tell you that based on the data we've collected, we do see that is definitely something that's occurring, and the providers have told us about that as well. Also, I think I'm going to turn it over to Commissioner Turner because I think he'd like to say a few words about this as well. So, Commissioner, if you'd like to add, the floor is yours.
Yeah, thanks, Karen. It's a great question. Just to kind of piggyback off of Karen's comments, that's also something on an enterprise-wide level that the governor's office is working on, coordinated messaging not only with departments but with other private industries in the state, working together on messaging campaigns, advertisements, public announcements, promotions, things like that. So there might not be something specific to DIDD that Karen and her team specifically own, but there are coordinated efforts that are going to be coming out of the governor's office around encouraging people around efficacy with the vaccines and safety precautions and reasons why it's good to take that. Again, we're not mandating that. We're not telling people they have to take it, but there are solid factual pieces of information from a science perspective that not only our clinical team with Dr. Davis, but the governor's office, the commissioner, Piercy of the Department of Health are going to continue to promote across the state of Tennessee, and DSPs will obviously fall into that target audience, those that work with vulnerable populations, those in rural areas, et cetera. So just wanted to add a little bit more context to that as well, Kara. The governor's office is also aware of some of the challenges around the rollout's going pretty good, but there are some challenges with people wanting to take the vaccine, and they're working to try to create some creative ways to make them feel better about that process. Thanks, Kara.
Okay. Thank you very much, Commissioner. And just in case you all are unaware, Governor Lee has announced that all Tennesseans age 16 and up will be eligible for the vaccine starting on April 5th. So, so spread the word and tell your friends. Okay, with the changes upcoming, does this mean that people in ECF currently will be eligible for hospital attendant funding? Jordan.
Yeah, not right now. So services, as we've indicated, will remain the same for people in the 1915C programs and people in the ECF programs. There won't be changes with the exception, obviously, of adding the enabling technology benefit to both the ECF and 1915C programs. There won't be other modifications or new services added. And so at this point, it will be folks within the 1915C program that remain eligible for hospital attendant services and that will not be added to the ECF menu. Certainly, as we move forward and start to consider single system design concepts, that's a void and that's an area that we're going to need to be able to address. And we certainly will do that as the conversation ensues.
Great. And then next question, I'm going to turn it over to Pat Nichols. So after the 7.1 with the integration, is there already a new QA tool that will be used for ECF as well as DIDD surveys, or will one of the current tools be adopted for both? Pat, would you like to answer this question?
Yes, thank you, Kara. That's an excellent question, and it has been coming up regularly to us because of the alignment. At the current time and past 7.1, for the foreseeable future anyway, we will continue to use the current DIDD QA tool for the 1915C programs and the ECF choices tool, quality review tool for ECF. We are working on an aligned tool that looking at both of the tools that we have existing now for things that can be done and utilized from both of those to make sure that we have the best tool to cover the things that need to be covered. But for the foreseeable future, we will continue to utilize the two tools. Thanks, Kara.
Okay, just to confirm, all people 16 and older will be eligible for the vaccine on 4/5/21. Yes, and just to make sure I didn't speak out of turn, I pulled up Governor Lee's Facebook page, and it says 16 plus are eligible statewide on April 5th. So like I said, tell your friends, and for those who are anxious and excited to get their shot, that will be the case. All Tennesseans over 16 and will be able to get it on that schedule on that date. Is there any plan to revise the provider manual based on the alignment?
Hey, Kara, I can answer that.
All right, thanks a lot, Teresa.
You're welcome. No, there is not a plan. The IDD will no longer hold a provider manual come 7/1. The provider manual will be held by the MCOs, and I know the MCOs are currently working on additions to their current provider manuals to include 1915C services. So the short answer is no. DIDD will also no longer have policies that are applicable to providers in the 1915C waiver services. Those will be held by TennCare through protocols. The only policies that DIDD may continue to hold would be for the Katie Beckett program, as that's not part of 7-1 alignment. Thanks, Kara.
Okay. And with that, I think that we are at a point where office hours is ready to conclude. So with that, I'm going to turn it over to Commissioner Turner to say a few words to see us on out.
Yeah, thanks, Kara. Again, a lot of good questions this morning. Appreciate you guys continuing to participate in this. Hopefully, it is continuing to be worth your time. We get a lot of positive feedback about office hours from people that are engaging and interacting in the communications between our office and your different agencies. Just really appreciate the relationship, and we're going to keep moving forward. July 1st is getting closer and closer every week. And we certainly feel good about where we're at, but we want to continue to keep you updated and make sure that we're sharing all the relevant information with you and your agencies on what's going on, and we're going to keep doing that. So with that, I'll turn it back to Kara and let her see us out. But again, thanks everybody for your time and participation today. Kara?
And I did want to make mention really quickly of one thing that I was going to mention after Jordan discussed enabling technology. Really quickly, is that we are planning a tech summit for November 17th and 18th. We are currently exploring the in-person option for that tech summit and working on it in earnest to line up speakers and to start to get an agenda set. So please keep an eye out for information about that. We are excited to bring that event back this year, a little later than we normally do, but we are thrilled with the promise of being able to provide that information to you all. So we'll get some we'll have some announcements about that coming up in the future. But we just wanted to let you know. Save the date, November 17th, 18th, and we're looking forward to it. Okay, with that, I'll let you all go, and we'll talk to you next Wednesday. Have a great week.